Hello, I'm going to go over the post-operative instructions following your dental extraction.
If I try to eat or drink when my lip is numb, what are the risks?
When your lip is numb, you don't have any sensation in your lip, so there's always a risk that you could bite your lip or scold your lip without realizing it. So it's very important that you wait for the numbness to wear off. One way of knowing when the numbness has worn off is if you compare the numb side with the unaffected side. When both sides feel the same, you then know it's safe to proceed with eating and drinking.
How long will the numbness in my lip or cheek last, and what can I eat once it wears off?
The numbness lasts usually about 3 to 4 hours. Once the numbness has worn off, you can eat a soft diet or a liquid diet. A soft diet could include, for example, omelets, soft-boiled eggs, pureed food, indeed whatever you're comfortable with.
Should I expect swelling, and how can I reduce it?
Firstly, it's not uncommon for swelling to happen following the dental extraction, and that swelling could increase for 2 days. So there are ways in which you can reduce the swelling, and one is through the application of cold compression packs, such as this, to the operated site. One would put the pack for about 3 minutes and then take it off and continue for the next 2 days. Sometimes these packs get warm, in which case you have to refreeze them.
Can I rinse my mouth?
It's advisable not to rinse your mouth for the first 24 hours after surgery. There is a risk if you rinse that you might actually cause bleeding.
What happens if there is bleeding from the operation site?
It's not uncommon to have a little bit of oozing from the operation site, but if you have true bleeding, it's important that we arrest the bleeding. And one method is to use the gauze pack that we have provided, roll it up and bite onto it at the extraction site. And you need to bite for about 10 minutes.
What is a dry socket?
A blood clot is required for healing of the socket. If a blood clot fails to form or is washed away, then you might get a condition called a dry socket. It can be treated, but it may take a little bit of time.
Any advice about the antibiotics and painkillers that have been prescribed?
The antibiotics and analgesia that have been prescribed, you should take as instructed. Antibiotics, if they give rise to diarrhea or a rash, you must stop immediately. As far as the analgesia is concerned, we use non-steroidal anti-inflammatory drugs quite often. These should be taken after food. Again, if you develop a rash or any side effects, you must stop these as well. Take 2 paracetamol 500 mg tablets every 6 hours as instructed.